At the president's direction, yesterday I met with 2,000 Hispanic leaders from their communities, and today the vice president led a phone call that I was on with hundreds of African American leaders, including the Reverend Jesse Jackson, including Derek Johnson of the NAACP, including the National Medical Association and the Black Nurses Association, to talk about some of the alarming trends we're observing regarding the impact of COVID-19 on communities of color. And you've heard the stats in New York City. Hispanics represent the majority of deaths. In Milwaukee County, blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans, develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and black boys are 3 times as likely to die of asthma as their white counterparts. As a matter of fact, I've been carrying around an inhaler in my pocket for 40 years out of fear of having a fatal asthma attack. And I hope that showing you this inhaler shows little kids with asthma all across the country that they can grow up to be Surgeon General one day. But I more immediately share it so that everyone knows it doesn't matter if you look fit, if you look young, you are still at risk for getting and spreading and dying from coronavirus. The chronic burden of medical ills is likely to make people of color, especially, less resilient to the ravages of COVID-19, and is possibly, in fact, likely that the burden of social ills is also contributing.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.